Welcome to Blomdahl. This is how to carry out nose piercing with Blomdahl's medical piercing system. Make sure the person you are about to pierce has reached the legal minimum age limit. If not, a parent or guardian's consent is required. Check that there are no medical conditions which mean that the client should not have their nose pierced. These conditions are listed in the client journal. Ask where on the nose wing the client wants to be pierced. Hand the client a soft disposable tissue so that they can blow their nose and clean the inside of the nostril where the piercing will be done. Ask the client to sit down on the piercing chair. Adjust the height to a comfortable working position. To choose a skin-friendly nose piercing stud, show the client the selection display. These are made from carefully selected titanium of pure medical quality and are developed in consultation with dermatologists to suit all, even those who already have nickel allergy. Remove your rings, bracelets or watch. Wash your hands and forearms thoroughly with liquid soap and clean running water. Dry your hands with a disposable paper towel. If the client's hair is in the way, use the hair clip to pull it back from the piercing area. Using a soft, disposable tissue, remove any makeup and grease from the client's nose wing. Check that the skin on the nose wing looks healthy. Should you notice any wounds or visible skin lesions, do not continue with the procedure. In consultation with the client, mark the desired location of the piercing. Use a skin marker from Blomdahl. The ideal position is usually in the crease line formed just above the lower part of the nose wing. To find the crease line, ask the client to deeply inhale through the nose. Never mark on damaged skin. Ask the client to approve the marking. For slightly thicker nose wings, use Blomdahl extra long nose piercing studs called long. To decide which length to use, stand behind the client and look into the nostril using a mirror. Consider the following when deciding on the length of the stud. If the nose piercing stud is too short, there will not be enough space for the mucous membrane to swell after piercing without encapsulating the tip. If the nose piercing stud is too long, the tip will irritate the septum between the nostrils. Use a large Blomdahl jumbo cotton bud to clean the inside of the nostril. Tear off the top of the packaging and soak the cotton bud with antiseptic solution containing no alcohol. Ask the client to insert the cotton bud into the nostril until it is level with the marking. Leave it in the nostril. Take the sterile disposable cassette containing the style of nose piercing stud selected by the client. Check that you have taken the correct style and that the packaging is intact. If not, discard the cassette. Fill in the aftercare instructions. Tear off the aftercare instructions with the terms and conditions. Give them to the client to read through and to take home. Fill in the client journal. The sterilisation lot number and article number are on the cassette packaging. Check the expiry date. Expired cassettes should be discarded. Mark on the picture which side of the nose you intend to pierce. Ask the client to fill in their data and to sign. By signing, they accept the terms and conditions and confirm that they have received written aftercare instructions. The client journal is your record of all nose piercings carried out. Now, the nose piercing procedure begins. Clean and disinfect your hands using a hand disinfectant containing at least 70% alcohol. Allow your hands to air dry. Then, put on disposable gloves. For nose piercing, use the mini instrument marked for mini studs only. Hold the instrument by its handle and cock the mechanism. Hold the instrument in your thumb grip. Place 2 fingers around the handle and 2 fingers loosely around the clamping pin. Your thumb should be straight up behind the trigger. When the client hears the sound which the instrument makes, the nose piercing stud is in place. Squeeze the clamping pin all the way to the bottom position and press the trigger straight down. Open one Blomdahl pre-piercing alcohol swab. It is intended for external use on healthy skin. With the cotton bud still in the nostril, press the pre-piercing swab against the outside of the nose for at least 20 seconds. Do not rub. Afterwards, dispose of the swab and cotton bud. Hold the instrument by the handle only and cock it. Open the packaging containing the sterile disposable cassette. Remove the cassette from the packaging and put it on the instrument. Hold the instrument by the handle only. Remove the safety cover and place it within reach. Ensure that you are holding the instrument correctly. Check that you can open and close the cassette by squeezing and releasing the clamping pin. The client should sit with a straight back, look straight forward, and tilt the head slightly downwards. Stand closely in front of the client. When piercing the client's right nose wing, place your right hand firmly against the back of the client's head. Hold the instrument in your left hand. When piercing the client's left nose wing, place your left hand firmly against the back of the client's head. Hold the instrument in your right hand. Hold the instrument horizontally and at a right angle relative to the nose wing. Insert the nose holder into the nostril until it is level with the marking. Gently move it towards the inside of the nose wing. Aim the piercing stud tip at the marking. In one single distinct and coordinated motion, move the instrument forwards, squeeze the clamping pin all the way to the bottom position, and tilt the instrument by lifting your arm. When the clamping pin has been squeezed all the way to the bottom position, the instrument should be held in a vertical position. If you are not satisfied with the positioning, or if the nose holder has started to slide out of the nostril, open the cassette and start again. With the cassette fully closed, you now have a firm grip of the nose wing. Keep your hand still. With your thumb, press the trigger on the instrument straight down. Hold for 3 seconds. Lift your thumb from the trigger. Open the cassette by slowly releasing the clamping pin. At the same time, bring the instrument upwards so that the nose holder remains in contact with the inside of the nose wing. Keep the instrument in a vertical position. Move it outwards and away from the client's nose. Advise the client not to touch. Put the safety cover back on the used cassette. Make sure the jewellery part of the nose stud lies against the skin on the nose wing. Use the mirror to check that the olive-shaped tip is fully visible inside the nostril. Cock the instrument and remove the cassette. Discard the cassette and the disposable gloves in a waste bin fitted with a plastic bag. Cleanse your hands with a hand disinfectant containing at least 70% alcohol. This indicates the completion of the procedure. Show the client the result. Go through the aftercare instructions. Remind them that it is their responsibility to take care of the new piercing. Take care of the instrument. There is no need to sterilise or disinfect the instrument. However, the instrument must always be kept clean. After each client, wipe the instrument with a disinfectant. Store the instrument uncocked and in a clean environment. Thank you for watching. We hope that you now feel confident and excited about offering nose piercing with Blomdahl Medical Piercing System. To learn more about Blomdahl, we welcome you to our website on blomdahl.com. You have just watched an international instruction film from Blomdahl Medical. National and local rules and regulations can differ slightly from this film. It is your responsibility to find out what applies for you. For more advice, please contact Blomdahl Medical or your Blomdahl sales representative.